Hey! So, how's my very pregnant friend doing?
Great.
Great. I know you're probably busy with all those STIs.
No, I had one of those way before I was pregnant.
Even if you've been tested before in the past, testing again during pregnancy is an important measure to take.
Remember, regardless of whether or not you have been tested for an STI in the past, getting tested during pregnancy is a very important precautionary measure to take.
Did you know that there are 20 million new infections in the U.S. each year?
That's great and all, but I don't have any symptoms.
Many STIs don't show symptoms, especially in women. Ever heard of trichomoniasis? Trichomoniasis, also known as trich, is the most common curable STD. In the United States, an estimated 3.7 million people have the infection. However, only about 30% develop any symptoms of trich. TB is the most common non-viral STI worldwide and has been associated with pelvic inflammatory disease and adverse pregnancy outcomes. Women who have HIV have high rates of TB, and women who have TB have excess rates of HIV. Prevalence of TB ranges from 6.1% to 52.5% among HIV-positive women compared with 3.2% to 34% among HIV-negative women.
Statistics aside, how would that affect me?
Well, pregnant women with trich are more likely to have their babies too early. Also, babies born to infected mothers are more likely to have a low birth weight. HIV infection is a prime example of how certain STDs may go unrecognized for many years, which allows for a wide dissemination of infection before it is detected and treated. Observational studies have shown that HIV infection is associated with varying rates of adverse pregnancy outcomes, such as increased spontaneous abortion, stillbirth, perinatal and infant mortality, and many other issues. Not to mention psychologically, it has been conclusively proven that women who contract HIV before or during pregnancy experience more depressive episodes. Trich needs to be studied more in order to understand its effect on pregnant women rather than just women in general. Although more research must be done, researchers have discovered that patients they studied that contracted trich tend to have more psychiatric disorders. In a much larger perspective, it has been proven that educators and counselors must avoid moralizing, but should instead offer people different options to protect themselves and others. On a population level, preventing the spread of STDs is more difficult without addressing social issues that have a tremendous influence on transmission of STDs. Some fundamental societal problems such as poverty, lack of education, and social inequity indirectly increases the prevalence of STDs in certain populations.
Why is this actually important? I mean, what are the real risks of me passing it to my own child?
Well, in the absence of treatment, the risk of vertical transmission of HIV is as high as 30%. With the implementation of HIV testing, counseling, antiretroviral medication, delivery by cesarean section prior to onset of labor, and discouraging breastfeeding, the mother-to-infant transmission has decreased to less than 2% in the United States. With treatment, the odds are now turned in your favor. With more pregnant women being tested, there has been a decrease in pediatric AIDS and HIV cases, likely from infected mothers and exposed infants receiving intervention to prevent perinatal HIV transmission.
If it's so important, why didn't my doctor test for it?
This is part of the problem. In the state of Florida, women need to ask to get tested because most doctors don't routinely check for it. Doctors and gynecologists should have procedures for requiring pregnant women to have STI screenings for HIV, trich, and other STIs that put the mother at risk and the baby at risk for preterm birth or other defects. Pregnant women should also be provided with more information regarding safe practices during pregnancy and safe medications to take if they have contracted an STI, in order to help both the mother and the baby. When a woman first finds out she is pregnant, STI screening should be one of the first things that is done in order to weigh out risk for mother and future child. Treating it early is better than later.
How do I get tested? And how do I get support afterwards?
There are so many resources available to get tested or receive treatment. There are several advocacy organizations available as well, including one right here at USF. If you have any questions or need help finding treatment, USF Student Health Services is here for you. You can also use this link to find testing locations closest to your home.
To make sure we addressed each dimension in its relation to our topic, we dedicated a specific section of the PSA for just that. The slide you see is how we planned out the information we intended to display before animating it. Of course, there are other portions of the PSA that dimensions could apply to, such as the portion where we talk about public health significance, or even the conversation between the two characters seen at the beginning of the PSA.
Okay, so my name is Lexi, and this is my reflection for the group PSA project. Although it would have been easier to meet up with my group and work on this project in person, I felt that we did an amazing job with meeting online and expressing concerns over parts of the project that specific people were in charge of. We communicated very well for it only being online, and were able to create something extremely unique because of this great communication. I learned a lot about HIV and trich and their negative associations with pregnancy, especially with its association psychologically on a woman experiencing pregnancy while also having contracted an STI. In addition, I specifically researched treatments for these STIs that are also safe for pregnant women and learned that most of these medications are already safe to take during pregnancy. But screening for these STIs must be done early in order for both the mother and baby to reap its benefits.
My opinion on the project was not what I thought it was going to be when I first heard we were going to do a group project. I learned many things in regards to my project's topic that I didn't even know about. For example, on how STI screenings and pregnancies affect us as a whole. There were some things I enjoyed about the project, but most of the time I had trouble finding information in regards to the social cultural dimension for our topic. Overall, I enjoyed doing the project. I enjoyed the communication I had with my group mates with deciding on ideas that was going to be put towards the project. Hopefully in the future, there will not be another health pandemic.
When first introduced to this project, I thought it was definitely going to be an entertaining couple of days watching my other classmates' PSAs. The main obstacle while working on this project was being separated from my group. Personally, though, getting my voice to fit the animation was harder than I first thought. I tried it several times, and finally with my group's encouragement, I got it down. Despite the obstacles, I ended up learning a lot, most notably about our healthcare system and its specific issues. I think our project came out pretty good in the end, and I hope you enjoyed watching it.
There were portions of the original PSA that we decided to cut out to help the presentation flow a little bit better. This is hard for me because I put a lot of time into everything I put into this animation. So here's an honorable mention to my binkies. But overall, we all greatly enjoyed doing this project. Having to communicate digitally actually helped out quite a bit. For the most part, people were able to respond to me immediately in order to help this process go a lot faster. Because of the creative process involved, it required that I had constant communication with my group partners in order to make sure that everything was flowing smoothly and reflected what we all wanted out of this project. The only thing I am disappointed by is the fact that we aren't able to show this to our classmates and watch their responses and get feedback from them. However, we are overall satisfied with how this project came out. Here's a list of references used in the makings of this video. I hope you enjoyed this presentation as much as we did.